Good evening, everybody. Hello, good evening. Let's see who's here. Pokari? Ano to? Keiko man? Future med student. Ooh, future med student. Abdul, hello, welcome. Wendell, hello. Pokari and Pokari at work? What is this? Pokari, do you have 2 accounts? Merong Pokari, tapos may Pokari at work. Ano yan, work? Are you using a work account to watch my stream? I'm calling you out. Oy, sinong boss nito? Who is Pokari's boss? He is watching a VTuber while working. Using a work account. Captain Jack Sanji, hello. Welcome. Hello, Arcanite, hello. Hello, everybody. Good evening. So, this is actually kind of scuffed because I am not prepared to do this one. I am not prepared. You see, I was like, I have to do a medical education stream this month because it is almost the end of the month. I had no medical education stream last month, I think. I don't think I had any. And then I was supposed to do one this month, but then I got so busy. And then I'm like, okay, I need to do a medical education stream before I go to work. But then this one is not about the anatomy or like, you know, medical, not exactly medical in terms of like human body stuff. This is more of hospital things. Something like that, especially in the Philippines. So yes, if you're a medical student, if you're an intern, plan to become a medical student, plan to become a doctor, or any of those, or if you're already graduated, medical school or already graduated internship, and don't know what to do, this is for you. So this is actually something I can tell people who are not in the medical field and those who, like, an advice to those in the medical field or those who want to be a doctor. But everything I say is gonna be everything I say in this stream is gonna be based on what I experienced and what I heard from other people, observations, and what else? Yeah, basically that. Okay. Now let's see. Let's start off with. Okay, what happens? What happens after med school? So let's start with med school. So we got one future med student here. Okay. So we have one future med student. You gotta finish your pre-med, and then when you go to med school in the Philippines, it's depending on your college or depending on where you're taking pre-med. I think some colleges offer like straight med course. I think like UP has that, and I think also some schools have it. I don't know if UST has. Like, you know, if you think about medical school, the ones you always think about are like UST. UST is like one of the top ones. UPPGH, UERM, UERMMMC. I think LaSalle also. I don't know if... I think Ateneo also has a medical school. Yeah, Ateneo. Intermed, yes. Intermed. Yes, that one. What else? Yeah, basta. I think FU has a med school. There's a lot. But the top ones, on the top of my head, the top ones are like UP, UST, UERM, MMMC, UERM. There's so many M's in that one. UE. I'll just say UE. UP, USD, UE. All the ones that have letter U in them. Oh, and yeah, La Salle offers straight. Yeah, I remember that. De La Salle. De La Salle offers a straight med course. So, if you wanna be, so it's like if you want to, when you go to med school, you gotta choose your school wisely, okay? Choose wisely. Choose wisely meaning what suits you, if you can handle it, you know, that stuff. Know the culture. Of course, I can't speak for other, because I only went to one med school, of course, so I don't know how it is in others. I can only base on what people tell me. Dalawa naman choices, blue and green. I don't know if Ateneo's I don't hear much about Ateneo's med school, but I know La Salle's. Anyway. Of course, the top ones, I told you, the ones with the U's. A lot of doctors I know are from UST. There are a lot from UP. I think majority are like UST and UP. Most of the ones I know are from UST. There, where did you go for pre-med and med? I am not gonna disclose that information. That's private. That is private. Anyway, the ones I know are from UP and UST. Mostly UST. What else? I know a few from La Salle. Actually, I don't even know much from Ateneo. Okay, so anyway, it's up to you. It's up to you. Where you think you'll do best. Okay, it's like this. From what I observed, okay, from the interns that I've handled or worked with. Interns from La Salle are really good at doing IV insertions, and when you're an intern, they require you to do all those things: IV insertions, Foley catheter insertions, NGT insertions. Ones from La Salle are good at it. They're okay. They're good at it. And also the ones from UE, they're good at it. UP, I'm not so sure. I haven't really had a UP intern, but I would say they are, because the hospital next to them is a PGH, and PGH is like I don't know. That's a lot of people. That's a lot of patients in there. They get everybody. They get all the patients there. I would say they're probably also good at that. Now UST is a different story. I had like multiple UST interns. They are really good. UST in general, they are really good with theoreticals. They are really good at knowledge. Like if you ask them a theoretical question, they can answer it like almost immediately. They know the answer. So UST is really good at probably at theoreticals. But then when you ask them to do insertions like NGT, Foley catheter, or that, all that stuff, they're at a loss. They can't do it that well. They're not that good. I'm sorry, they're not that good. They're not that good. I guess that makes up for the really the theoretical knowledge that they have. But the ones that I know that are really, but the best ones that I know that are really good at doing stuff like that, like insertions and stuff, little procedures, minor procedures, are the ones from Cebu. Cebu, CIM. Those guys are good. They are good. They were probably the best ones at doing minor procedures. So, yeah. Which interns are good for bullying? What the heck? I don't want to bully interns. I don't want to bully any interns. So anyway, what else? So anyway, yeah, just choose your school wisely. If you want to be really knowledgeable at things, like be really theoretical, USD. But then the sacrifice is that you're not really gonna be good at doing insertions and stuff. But I think in the long run, it's not that big of a problem. It'll just be what do you call this? A bit of a nuisance when you're in internship. So, that, and then, I think I would say UP students are well-rounded, I guess. And UE. LaSalle is really good at their minor procedures. Have you got any interns from UPM? Actually, no. Most of my interns were like LaSalle, Ateneo, UE, UST. It's up to you. You guys, it's up to you. Just choose wisely. So okay, next you're in med school. You're in med school, so if you're in med school, expect what do you call this? When you're in med school, when you start med school, your first year, you're going to expect a drastic drop in your social life. Okay? You still have weekends from your first year to third year. You still have your weekends. Cherish those weekends. I'm telling you now, cherish your weekends. Because they are gonna be the last weekends you they are going to be the last weekends you ever have for the next decade or something. Or I don't know, several years that you're gonna have after that. Okay? Cherish your weekends. You're gonna have a drastic drop in your social life. Why? Because even if you go to school Monday to Friday, they're going to bombard you with so many things you gotta do. Almost every other day you're gonna have a quiz. Or a long test or whatever. Almost every day you have a test. Or every other day. There's always a test, a quiz, or whatever. And you have to be studying and reading your books every day. Every time you get home, you gotta read. You gotta read every day. Or else you're gonna get left behind. I mean, I think, some schools, they make their own transcriptions. So, if you can't read, some people who are really, really bookish, they can read an entire chapter in like a few hours, and then they just make transcriptions. That's what some medical schools do. They make a handout version of the book. If at least, yeah, some not some schools, some people. My love life ba sa med school? Yeah, some people do have a love life, but it gets complicated because you're just too busy to do anything. I have seen people get together in med school, but then once they enter residency, they break up. Or internship, they break up. I have rarely seen a couple that got together in med school that actually lasted long. Once they entered residency or internship, it's gone. That's it. They're gone. They're gone forever. But anyway, yeah, just expect a drastic drop in your social life. You know, if you have like friends from college or high school that went to other courses and are working now, and they're like, "Hey, let's hang out on Friday night." You'll be like, "Oh wait, I can't, as I have an exam to study for." Or let's hang out on Saturday. I can't because I have an exam to study for on Monday. It's our finals or whatever, long test. That's what I mean. You will have a drastic drop on your social life. You'll still have like a bit of social life, but it'll drop. Okay. And then once you enter fourth year, once you're in your fourth year of med school, there's an even more drastic drop in your social life because this is when you start doing clinicals. No, you start doing clinicals in your third year. Third year is when you start doing clinicals, like half clinicals and half classroom, something like that. But when you're in your fourth year, it's all clinical. You're gonna be going on duty in the hospital. You're gonna be the dirt everybody walks on. You're gonna be the one everybody bullies. Literally, you're gonna be doing all the scut work. You're gonna be doing all the shit people don't like to do when you're in fourth year med school. You are the slaves, but you're being slaves for the sake of knowledge and training. So yeah, I expect even less another drastic drop in your social life because this is when you don't have weekends anymore. You're gonna be going on duty every 3 days. Sometimes it's every other day. This is when it all starts. The real medicine starts. In med school, are you happy when you get 1/100? Of course not. That is depressing. What the heck? I'd be depressed. Okay. What else? So after fourth year, once you survive fourth year, you have to take senior in your internship, which is after you graduate med school, you have the MD on your name, and then you have to take senior internship right before you take senior internship before you take the physician licensure exam. So senior internship is kind of like fourth year med school but a little higher. And this time you can have it done in almost any hospital. You don't need to have it done in your old hospital. You can, like, some people I know that had they did their med school in UP, but then they go to somewhere else for their internship, something like that. That one's only 1 year, and you do like rotations for each specialty. You rotate in internal medicine, pediatrics, surgery, orthopedics. What else? ENT, ophthalmology, OB-GYN, etc., etc. Okay. That's just 1 year, and then after that 1 year, you're gonna take the licensure exam. And if you pass the licensure exam, you are a full-fledged doctor. Okay? Once you pass the licensure exam and get licensed, you are officially a general practitioner. And you can start practicing. Okay? So this is where the road diverges in the medical field. Once you're done, once you have that license to practice, the road in front of you diverges. You can either start working as a general practitioner and start earning money as a general practitioner. So like you're a general doctor, you can treat patients, you can see patients, treat them, etc. So some people do that. They become doctor and then they're happy. They do clinics. Okay. And some people do clinics in companies, or become a company doctor or whatever. Or they go on duties in hospitals like that. Okay. We call that sometimes that's called moonlighting. We call it moonlighting. The other road is the harder road, which is going into specializing. So specializing is basically getting into residency. So what is residency? Okay. Let me open up a notepad here. Notepad. Okay, we're gonna talk about the residency proper now. Move this here. Let's make this larger. Okay, hold on. Let me open up my. Where is this one? Oh. Let's put it down here. I'm gonna put it down here so you guys can see. Okay, this is my little board. Okay. Oh wait, not this. I think I should have used MS Paint, not this one. Hold on, not this. MS Paint. We'll use MS Paint. There we go. No, the boobas are gonna. No! Boobas! What? See, ano, binakalo eh. No. Okay, there we go. It's so wide. Okay. Let's use text. Oh yeah. What font do I use here? Let's use a big font. Big font. So the road diverges. You have that is small. Residency. Oh. Residency. So what residency is basically specializing. Okay. So once you graduate and get your license, you have the choice to either continue as a general practitioner or you can specialize and then you enter residency that way. So residency is additional training. So it's additional training and it depends on what kind of specialty you want. Some residency training programs take like 3 years. Some are, I think majority are like 4 years. Majority is 4 years and some are 5 years. So as far as I know, if you want to specialize in internal medicine, it's 3 years. And then I think pediatrics is 4 years. Pediatrics is 4 years, I think. What else? Orthopedics is 5 years. I think it's 5 years or 4 years. Surgery is 5 years. What else? What else? ER emergency room. ER residency is I think it's 4 years. I think it's 4 years. I don't remember. I think it's 4 years. It's 3 to 4 years. I know internal medicine is like one of the shortest because after internal medicine you gotta after internal medicine there's still like subspecialties like after like if you want to be an endocrinologist, for example, you have to go through internal medicine and then you have to subspecialize again. For pediatrics, once you finish pediatrics, you can also do a subspecialty like pediatric neurology, pediatric endocrinology, pediatric cardiology. There's like a lot. And I don't know how long that takes. Okay, so once you're in so this is what my stream will be about. Residency. I will focus more on residency, because after residency there's still more. Like if you wanna subspecialize some more, like be more specific, there's fellowship, which is more like a few more years, like one year of fellowship or 2 years of fellowship, and then you're done. Depends. Some are just really short. I don't know how long the other fellowships are. Was targeted pediatric cardiology, possibly radiology. Oh, I think if it's pediatric cardiology, you have to go through pediatrics. So, and then I don't know how long the cardiology one is. I don't know how long that will take. Radiology, I think, is 4 years. So if I remember correctly, for radiology, like the first year they read like X-rays and stuff. I just remember this, and then second year they start reading CT scans, and then I think third year is like MRIs and stuff. I don't know. I don't remember anymore. Anyway, so. Now, this is the juicy part, residency. If, let's say you graduated internship and then you decide, okay, I want to go residency. I want to specialize. Specialize in residency. Specialize and take residency. Oh, wait, hold on. Someone's knocking on my door. Wait, hold on. Okay, I'm back. So what was I saying? What was I saying again? Okay, let's say you decided to take residency. Okay. If you're gonna take residency, choose your hospital wisely. Again, just like in med school, choose your hospital wisely. Okay, you have to know the hospital because when you take residency, you train in a hospital with the training program for that specific specialty you want. You gotta choose wisely. So general options, you have private hospital versus government hospital. So what are the pros and cons of this? Okay, hold on. Wait, I need to make this bigger. Okay, let's. There we go. Private versus government hospitals. So, do you want to have a lot of cases, like see more patients, and like have less time to do shit for yourself? You go to the government hospital. If you want more exposure and to like the actual a lot of patients, way more patients, and like the actual problems of the country, because the government hospitals is where patients who can't afford their treatment go to government hospital, right? So if you want those kinds of patients, if you want that kind of exposure, you go to the government hospital. Now, if you wanna be more comfortable, and learn the ideal stuff, wanna be in a more comfortable hospital, you wanna be in a hospital where they are able to give the best of care, the best and ideal care, the kind of care or treatment or that they can give a patient, you go to the private hospital. Because in a government hospital, don't expect to get ideal. Don't expect to get ideal. This is more of like they will try to be ideal, but they can't always be because they don't have the stuff that is the things or the ideal facilities, diagnostics, etc. They don't have that, unlike in private hospitals. So it really depends on what you want. But if you'll ask me which is better, I think they both have their own pros and cons. They're both good in the same they're both good for me. Okay? If you want to talk about money, government doctors are all welcome to say yes. Okay. Money. You don't earn that. When you're in a private hospital, you don't really get that much money. You don't get paid. You get a stipend, but that's in exchange of the comfort you get in this hospital. Like, I think I've worked on both. Okay, so I know how both are. In the private hospital, it's much more comfortable. It's much more comfortable, and but the pay is a lot less. Okay, the pay is it's lower than minimum wage. It's not really a salary, it's called a stipend. So, but in exchange for that, you have the comfort of having your own quarters with air conditioning and TV and whatever. You get free nutrition, free food. You get free what do you call this? Free medical checkups. So yeah. So that's the thing. That's the exchange. Something like that. In the government, you get paid big. Okay, you get paid bigger. It depends also on which hospital, but the pay is a lot bigger. But of course, the pay is a lot bigger, but also because it's a lot more tiring in the government hospital. So if you want big money, if you want to be tired all the time and yet still get paid, you go to the government hospital. But if you want to take it a little slow, a little, and get shit amount of money, you go to private. It really depends on what you want. It really depends on what you want. They both have their pros and cons. You just gotta weigh it and see which one you like better. So, expect patients in the private hospitals to be a little more like to be more parang maldita na VIP na Expect patients that complain more on private hospitals, but well, not really complain more, but they expect special treatment. In government hospital, not so much, but you will eventually get something like that. You would get the occasional patient that's like the occasional patient that's like typical, like what the hell are you doing here? You should be in a private hospital. That are those kinds. You occasionally get those, like they expect immediate service, but you can't do it because you're in a government hospital and it's not gonna be immediate. So yeah, there's that. Nakakatakot siguro yung mga batang iPad kid na pa siya. Actually, those iPad kids, the iPad works, actually. The ones who like on their phones. Because if you need to like do, you need to examine those kids or do whatever, you just give them their phone and they keep quiet. And they would not pay attention to you anymore. They'll be paying attention to the phone. It works! Yeah, it works! Are you a certified doctor? Yes, I am. Yeah, it's a distraction. Like, example, when we're doing circumcisions, just give them a phone. I think I said it on like Twitter or sometime before. I had a surgery mission, and then we were doing some circumcisions, and this one kid was playing Mobile Legends while being circumcised. You can like hear it, like first blood, first blood, while his thing was like leaking with blood. Hindi naman iPad, it's a phone. He was holding a phone. They do that. I mean, it's one of the best anesthesias. Just give a kid a phone or an iPad, and then that's okay. They're good with that. So sometimes the phone works. It keeps them distracted. So. What else? Let's see. In the private hospital, if we're let's say if you want to be a pediatrician, right? You're in pediatrics, or let's say you're in the ER. Expect a lot of mothers bringing their children to the hospital for like a fever, like a 2-hour fever. 2-hour fever. They bring their kid to the hospital, to the ER already. And you know, it pisses off the residents there. You'll be like, what the heck? You'd be like, why the hell did you bring your kid here when you could have just given, you know, paracetamol muna bago mo dalhin sa ospital? Government hospitals, you don't really expect those. So expect basically expect in government in private hospitals, you get patients that complain about the smallest things. Like if you're a pediatrician, a mother will bring their child to the ER looking for a pediatrician, saying, "My son or my daughter has fever for 2 hours," or you know. Or you get the occasional patient that, usually no, I don't want to throw shade so much, but it's common. I'm sorry, but this is common, okay? Never fails. Call center agents. Going to the ER complaining of headache and stomach pain. And then when you examine them, there's nothing wrong with them. And then they start asking for a medical certificate or an excuse to get out of work. Oh god. There have been so many of these. Okay? You know, these kinds of patients piss off the doctors a lot. Like, I remember when I remember talking to an ER doctor. He was telling me about this. He was like, oh, he had this patient that came in complaining of stomach pain, okay? But then when he examined him, there was like really nothing wrong. It was a soft abdomen. It was non-tender. And then he would be like, ah, sakit ng tiyan ko. It hurts so much. But then when he palpated, there's nothing wrong. So he's like, he could tell that he's just like being he could tell that he was being a bitch. So he told the nurses also were kind of annoyed, so they used the largest needle to they get the largest needle and then, you know, put an IV line using the largest needle, and then gave IV medications. So yeah, they know if you're faking shit, okay? Yeah, HMO. Yeah, some people take advantage of their HMO. How packed your schedule is. I thought a doctor would be hectic. Oh, it is. My schedule is really packed. It's really, really packed. I am able to find time to stream. It really depends also. Like, this week I only have 2 scheduled streams. So, you know. Sa sobrang irita, pinagulat Aya. What else? If forget, okay. Government hospital patients. Now these ones, okay. So if in the privates you get like patients who complain of the smallest things. In government hospitals, it's a different story. It's a different story. It's the other side of the spectrum, okay? Other side of the spectrum. You get a patient that complains of sasabihin niya, may pigsa ako sa likod. Okay? They go to the ER. May pigsa kasi ako sa likod. But then, you know, when you, like, they have a boil or at their back, and their backs. They go, I have this boil in my back. And then when you look at their back, it is not, hindi siya pigsa. It's not a boil. It's a whole big-ass abscess. It's like a foot-long abscess. Or a 1 foot big abscess on his back. And you'd be thinking, like, san dito? Hindi to pigsa. Ano to? Hindi to pigsa. Paano naging pigsa to? Yeah, I told you, it's worse. There are those who are like that. They're like, ay, Doc, mayroon kasi akong bukol dito sa balikat. I have this tumor on my shoulder. In the private hospital, you would expect like a 2 centimeter tumor or 2 centimeter bukol or whatever, like 2 to 3 cms. Sa government hospital, it's gonna be like 10 centimeters or 15 centimeters. Like, what the hell? Ba't ang laki? they like, so basically these people, because they don't well, it's understandable. Usually the patients here are unable to afford healthcare, right? So if they're sick, if they have something, they don't consult right away. They let it be. They leave it alone until it gets worse, and the only time they check up is when it's really, really bad. So that's the thing. Yeah, it's just a scratch. Yeah, it's like, oh, it's just a scratch, but then when you look at it, it's like a whole ass laceration. Yeah, that's the thing. That's what's wrong. That's what's bad here. I get like and then also you know those women who have breast tumors, breast mass. They'll be like they end up going to the ER because they have breast cancer that like ate up their whole breast, and it's all necrotic and smells bad. So when you ask them, oh, how long have you had this? They'll be like, oh, it was just 2 weeks. I'm like, 2 weeks? 2 weeks? Breast mass, and it ate your whole breast and it's this bad? I'm like, that's not 2 weeks. You're lying. You're lying. It's not 2 weeks. That has been months. You had a breast tumor months ago, or at least years ago, and you didn't check up. You just waited for it to be like this. Yeah, they would say 2 weeks when it's actually like, yeah, probably 2 years. And it happens. But this is the reality of things. If they can't afford their treatment or diagnostics, they just walk it off. They don't have it checked. So yeah, so they're pretty much like extreme opposites, the private and the government. So just expect like more of the masses here, and then on the private is more of the more higher socioeconomic status people. There are some, but you know, some private hospitals have a charity program. So those who are unable to really afford, they are still able to go to private hospitals because of the charity program. So that's one thing. So what else? Okay. So 1, you choose your hospital wisely. So private versus government. If you want to go private, there's like a lot of hospitals, like St. Luke's. I think someone's mentioned St. Luke's. St. Luke's is one. There's Medical City, Medical City, Makati Medical Center. What else? Chinese Gen. Is Chinese? I think Chinese Gen is a private hospital. I don't know. There's a lot. Government hospitals, basically. UP, PGH. PGH is the largest one. PGH. There's hospital ng whatever city you're in. Hospital ng Maynila, hospital ng Makati, hospital ng whatever. Hello, ex-OB-GYN University. Yeah, it was tough. Oh, yes! Okay. So, just pick one. Pick your poison. Private or government. Okay? Next. And then, pick your hospital. Before you join your residency, before you join a residency program, make sure you know, also, like I said, choose private or government, and then also know the hospital you're going into. And not the hospital, and when I say know the hospital, not just what it has and what it's capable, what their facilities are, but you gotta know the training program, and who's in it, and how they are, okay? Because this is like looking, this is like a big circle, right? Let's see, is there a shape here? Let's draw a circle. Let's draw a brown circle. Outline. Solid color brown. Fill it. Size. Okay. Okay, know your hospital. Oh. So, brown is knowing your hospital. You gotta know also the program you're in. Okay, let's put a text here. Alright. Hospital. Okay. Let's make this smaller. The hospital. The hospital, there we go. You gotta know also the... There's also this. The program, training program. Okay, you gotta know the training, about the training program, okay? And then, other than that, so other than the training program, the next circle, is getting smaller. Culture. Culture! There we go, the culture. Okay, I don't know if you guys can see this, but let's let me zoom in. Let me zoom through it. There we go. Okay. So, know your hospital, know the hospital. Know the hospital, so know how, you know, if they have what you want, like nice facilities, if they have, if it's like near your place or whatever the location. Other than that, know the training program, okay? How is it? Are they accredited? How is their status and all that? Okay. And then lastly, know the culture. Okay? So, for training program, it's basically like, their status, like if they are accredited, if they have no like problems with their accreditation, because you can't just go to any hospital and take residency training. They have to be accredited, because they have to be accredited by the society of whatever specialization you're taking. Like in surgery, there is a PSGS, or Philippine Society of General Surgeons, and there's also PCS, Philippine College of Surgeons. Pediatrics has their own also, like I think it's like Philippine Society of Pediatrics. I think IM also. They all have their own. Okay. So, what else? Know if they have enough cases for their training program. There we go. Do they get enough cases for their training program? Especially in surgery, you need a certain number of cases to graduate. So you gotta know if they get enough. Okay. I didn't know anything about the hospital I got in before joining. We had so many C-sections per day, almost 20 per day. I had to drop a 20? Wait, what? 20 per day? That's a lot! But then again, I think in, like, hospitals, like, saan ba yung ano? I think I rotated one time in another, when I was an intern, I rotated in a government hospital. They get a lot of, but then it wasn't CS, it was more of natural, spontaneous deliveries. 20 C-sections, what the heck? That is a lot. Why do hospitals still use outdated machines like beepers? Wait, what? What hospital uses a beeper? I don't know a hospital. I don't use we didn't use beepers before. What the heck? I don't know a hospital that uses beepers. We use cell phones or a pager. I don't know what hospital uses a pager. We just use cell phones. They get our numbers, and then they bother us with our cell phones. Or some hospitals have their own, like, duty cell phone. Anyway, continuing on. So after training program, after a training program, culture. This is where it differs. Okay. Culture. Let me draw. So, culture, this is where each hospital, are different. This is where each hospital is different. They have different, cultures. Culture meaning, like how the residency, or not the residency, your co-residents are. In South America, okay. Over here in the Philippines, we promote natural, spontaneous deliveries, but some patients who some patients would choose a C-section if they don't want to. There are some patients who choose it, but then the the default is to go with NSD. So anyway, yeah, culture. You gotta know the culture of when you're picking your residency, you have to know the culture. This one's a little hard, cause when you ask people, kumusta? How is it in this? How is it in PGH? How is it in ganyan? How is it in St. Luke's? How is it in whatever? They'll be like, it's cool here. Okay, dito, whatever. It's good here. You get a lot of cases. It's whatever, you know, all that. Okay. But you gotta take those with a grain of salt. Take it with a grain of salt. Now, I don't wanna... Wait, are there any... I hope there are not any residents here, or... but I might get... Because, okay, I'm gonna tell you guys, residency is not easy. Okay, when you're in a residency, you gotta know all these things. You gotta know the important one is culture, because, especially here in the Philippines. Okay, this is about Philippines residency. I'm not sure how it is abroad. Maybe it's better abroad, or I don't know. But I have a feeling that in general residency is basically the same. Expect that there is a hierarchy you have to follow. So in some residencies, you have like 3 years or 4 years. Expect a hierarchy. So the highest resident, let's say in surgery, there's 5 years, right? The highest in the hierarchy is the 5th year. And then, you have the 4th year, 3rd year, the 3rd year, and then, 2nd year. And then 1st year is the bottom, okay? First year's the bottom, they're the dirt. They're the ones they boss everybody, they boss you around. Yeah, you're a paid slave, that's what you are in 1st year. You're gonna do all the scut work as a resident. You're gonna be doing all the shit nobody wants to do. And in some residency training programs, just know that in general residency is very heavy. It's not for everyone. Not everybody can handle residency. That's why I know some people who try their hand. They want to be like, oh, I want to be a surgeon, or I want to be something. They go into residency and they can't handle it. They can't handle it, so they leave. Because this residency is very brutal. Okay, it's very brutal. In surgery, it's even more brutal. I don't know how to compare it to other specialties, but surgery is a very brutal specialty in residency. I'm scared for my mental health. Yeah, you gotta be strong mentally, emotionally, and physically to be here. Expect when you're a 1st year, you're gonna get a lot of the brunt of the work. Like, you're gonna be doing rounds in the entire hospital. Let's say if you're in a hospital that has 9 floors, you're gonna be doing rounds on all 9 floors. You're going to be holding the census, patient census, patient, and you gotta do rounds on all of those. All the patients there, and then you're gonna check on them. You're gonna answer calls. Like, if a nurse calls you, like, hey, this patient in room whatever is complaining about abdominal pain. Can you please assess the patient? Yeah, you're gonna have to go there, assess the patient, and do something about it. Sometimes patients can be really, sometimes you'll have to deal with difficult patients. Like, you know, some patients are nice and understanding, but some other patients can be assholes. Not joking. They can be really demanding. So you gotta learn how to deal with those too. 1st years are not allowed to sleep. Yeah, in some programs they'll be like, you should not be caught sleeping. I got caught sleeping multiple times, but they weren't that strict, so they didn't give it. They just take my picture. I got caught sleeping in a nurse station. And they just, my chief resident just took a picture of me and then, like, posted it on our Viber group. And they're like, you're not working, but it's like a joke. They don't really care. As long as you get work done, they don't really care. Yeah, it's brutal. So you're gonna do all of this. Like, for example, you in a residency, the division of the duty status, we have 3 duty statuses. There is the pre-duty. There is pre-duty. There is duty. And from duty or post-duty. Okay, from duty. We call this pre-duty or from. Okay. If you notice, so this is when this thing starts in 4th year med school, when you start doing pre-duty, from duty, pre-duty, duty, and from duty statuses. It starts in 4th year med school, and this is how you will live your life. Have you done the same thing too? What do you mean, like go here? I mean, pre-duty. This is how my life is. Like from med school, 4th year to internship, residency, like that. Even when you're a junior consultant or a consultant, if you pick this kind of schedule, this is what your schedule will be. Depends on what kind of work you want done. Anyway. So, this is how life is as a first year, as a resident. This is your life every day, pre-duty, duty from duty. And then, when usually in surgery, if you're pre-duty, you're going to be in the operating room. In surgery, pre-duty is operating room. If you're on duty in surgery, it's answering ward calls. So this one, patient census, doing rounds, ward calls. If you're from duty, this is a outpatient department. Catching a new resident sleep. Yeah, I did. Since they did that to me, I did that too. When I had like junior residents and I catch them sleeping, I just take photos of them and then I show it to everybody. Like, hey, look, he's sleeping. I'm like, hey, look at this, he's sleeping. Sleeping on a job. But, I don't really get angry or anything. I don't. It's just funny. Look at this guy, he's so tired, he's sleeping, and take a photo. But I don't really, I mean, I'm the type of person that if, I understand how hard it is, so I don't really get angry or anything. I don't want, like, I'm the type who doesn't want my juniors or the ones below me to have a hard, to, like, experience what I did, basically. If I had a hard time, I don't want them to suffer like that much. Especially if I feel that what I experience is unfair or really bad. So that's, anyway. So for surgery, first year, you do floors, answer everything. You also, as a first year, you gotta make sure that you don't bother, this is a hierarchy, right? So as a first year, you have to get everything. You have to catch everything. And your goal is to, like, not bother your seniors. Your goal is to catch every, like, not wake up your 2nd year or your 3rd year and make sure it does not reach the 5th year. If the concerns reach the 5th year, there is something wrong. When I was a first year resident, I did all this. I always had like a bottle of a beverage on one pocket, and then I had like snacks on my other, and I'd be walking around eating. Like before, I had like there was this senior resident who was like, bawal kumain unless kumain ang senior. They'd be like, you're not allowed to eat unless the senior eats. And I'm like, I was like being a first year resident, like I don't give a shit. I have a bottle of water on one pocket and I have snacks on the other. Like, you guys don't eat. I am eating while doing rounds. I am eating while doing rounds. And then they just see me like, "Oy, bawal kumain." I'm like, and I'm like eating on my crackers. I'm like chewing. I'm like, I'm still working. Doesn't matter. I'm working though. I'm working. I'm doing my rounds. I'm doing what I can. I'm just eating up while I'm just multitasking. I'm just multitasking. You can't do shit. Okay. Yeah, they didn't really give a shit actually because I was still working. I was still doing rounds. Technically, I was still doing rounds. I wasn't taking a break. I was walking around the hospital with like a bottle of water on one hand and then crackers on the other. So, you know, I found the loophole. I broke the system. Anyway. So yeah, it's a hierarchy. When you're second year is pretty much the same. I think second year handles surgical ER. Third years handle like they have a rotation in subspecialty. Fourth year and fifth years they just operate. They just stay in the operating room. Or like yeah, that's what they do. Parang kulang na lang may hazing sa labas. Yeah, you know what? Come to think of it, residency is kind of like a frat in a way, or a sorority in a way. They really, it's really brutal. Like I said, it's really brutal. If you want to specialize, you gotta go through residency. Like, for example, you want to be a certain kind of doctor. You want to be, internal medicine. You want to be a rheumatologist, or you want to be a surgeon, or you want to be a pediatrician. You gotta go through residency. It's unavoidable. That's why I say you gotta know the culture, because some residency training programs I believe are kinder, or some cultures are kinder to their residents. Others are brutal. Okay, and I don't know if there are any. I hope there are not. I don't want to be like, for example, I would say a certain large government hospital, the largest government hospital. I think they're brutal. Okay, I think based on what I have seen, okay, and heard, I think they are very brutal. They are brutal. Especially because they're the largest government hospital, so they get a huge volume of patients, so I would expect that they are very brutal there. I mean, I have seen, there are a lot of residents who leave, or a lot of people who quit residency because of how brutal it can get. Sa inyo, Doc, brutal o hindi? Half-half, I guess. It's not as bad as other government hospitals or other I think it's not. I think private hospitals in general are not as brutal as government hospitals. I think government hospitals are more brutal to their residents. So the culture is more brutal than private hospitals. I think in private hospitals it has its own. It's not as bad. Baka nasanay ka lang sa brutal. Maybe. No, I don't think so, because I heard stories. And I'm like, what the hell? I've heard stories and I'm like, oh no, I did not experience something like that. So, no. I think my hospital is not as brutal as, or where I trained is not as brutal. Because I have heard stories of others, and it's bad. It is bad. Or really, not really bad, but very brutal. This is to a bear that's basically, I was so locked in, I started to look like a lunatic. I had to drop it because of neurologic. Oh, okay, I see. Like, let's see, for example, I heard, okay, this one, some, especially in government hospitals, okay, if you do something unacceptable or wrong, or let's say you made a mistake, you get punished in a way, you get sanctioned. But if the consultant or the senior gets really angry at you, if they get angry, they can insult you. They insult you. Or they really curse. Nagmumura, basically. Nagmumura sila. Mumurahin ka talaga. Mumurahin ka ng senior mo or mumurahin ka ng consultant. They would like really yell at you and like mumurahin ka. Punishment extra shift, or yeah, if you do something bad, you go on duty again. Like perpetual, you call it perpetual duty. Like if you do something wrong, if you're kung mati ka sa ulo mo, they will make you go on duty again. Let's say you're from duty. You just got off duty. You're from duty, right? You did something wrong. You're gonna go on duty again. Right? You're gonna go on duty again. So as you're supposedly after from duty, you're supposed to be pre-duty. But then since you got punished, you're gonna go on duty again. And then after that, you don't go back to being, and after you go on duty, you're from duty. But you know, your actual schedule, your proper schedule doesn't let you go on pre-duty. Because you're gonna be actually duty again the next day. So what happens is every other day you go on duty. So like for example me. Let's say me. I'm a junior resident. Today is June 24. Today, June 24, I am post duty or from duty. Right? I did something bad. Or they caught me doing something bad, they punished me. So today I'm supposed to go home, right? If today I'm supposed to go home, I'm not allowed to go home. I have to go on duty again. I have to stay in the hospital, right? If I went home today, tomorrow I would be a pre-duty status. I could still go home. And then my next duty status would be on Wednesday. Yeah? But since I did something wrong, I got punished, I'm on duty today. Tomorrow, instead of being pre-duty, I am from duty again. And then Wednesday, I am duty again. You know, that's how it is. If you're a resident and you mark out and the seniors tell you to go back, you go to the yeah, they do. If you go home, this happened to me before. I think I talked about this. Like, well, no, I was on duty that time. My co-residents, first years, they were like pre-duty, from duty, they went home. And then our chief resident got angry for a weird reason. And he was like, "Where are all the first years? You all gotta be here at 9 p.m. Like, one of them was going on a date in Rockwell Mall. And then the other one was on a bus going north. Going like northern part, I don't know, going to somewhere north. Or was it south? I don't know where it was. And they had to go back to the hospital. That was crazy. And I was like, I didn't give a shit because I was on duty. I'm like, hey guys, you gotta go. He's angry. Get back here. I was on duty, so I didn't care. It was funny though that the guy who was on a date in Rockwell had to like leave. We were like, where are you coming from? Nasa Rockwell ako. Yeah. But yeah, okay, so yeah. So if you're a junior resident, you get a big your workload is very heavy. The lower you are on the hierarchy, the heavier your workload is, but the higher you go up in the hierarchy, the workload is less. The workload is less, but the responsibility goes higher. So it's basically they're inversely proportional. Workload. Workload and then responsibility. I'm using a mouse to write. So the workload goes down the higher you go, but the responsibility goes up higher. So in a way, you can say that, oh, it's a lot, junior residents will be like, oh, it's a lot easier when you're a senior. They have it easy and all that, A lot of juniors would think that. Oh my god, the seniors have it easy. All they do is sleep all day. But the higher you are in the hierarchy, the more responsibility you have, the more you're responsible for things. If something goes wrong down in the hierarchy, in the lower part, you're gonna be blamed for it. So that is why the seniors get angry at the first year, the juniors, for doing something wrong. Because anything wrong that the junior does becomes the fault of the senior. Because that means you're not watching, you're not taking care of the junior, you're not teaching them properly. Something like that. Of course, this is all based on what I've experienced, okay? It may not be the same for other residency training programs because I don't know how the culture is in all the other hospitals, but in the ones I know, this is how it is. Some seniors will treat you like their baby and others like a soldier. OB-GYN sucks more. Actually, when it comes to gynecology, I think gynecology is like a different breed of surgery residency. Surgery residency is brutal, but I think OB-GYN, I have, when I was an intern and I would observe the OB-gynecologists OB-gynecology residents, it's brutal. I think they have it worse than surgery. Surgery is brutal in itself, but I think OB is a lot more brutal. Because, surgery is more of a, let's put it this way. Surgery is, in general, masculine, or it's, there are more male surgeons. And I think in OB-GYN, it's more female. So, in OB-GYN, so, if you think it's more female in OB-GYN, they are more hormonal. I noticed this. The gynecologists would just snap at the seniors would just snap at the first years. I mean that's how I could explain it. The majority of OB gynecologists, at least from what I know, they're female. Surgeons are mostly male, so Imagine being surrounded by hormonal women, okay? They could just snap at you anytime, especially if it's if pag malapit na yung regla nila, di ba? Imagine if they're all gonna get their periods at the same time. You poor junior. I had only 2 male yearmates, see? And the rest are women. So imagine if they all had their period at the same time. I remember this when I was an intern. I noticed how hormonal the OB-GYN residents are. They're like, it's crazy. It does happen, especially when there are females working together. Yeah. So yeah, I think that's one thing. I think OB-GYNecology is actually more brutal than surgery. Because of that one factor that majority are female and they get hormonal. They will just snap at you. In surgery, if you have a female senior who is also hormonal, then you will die. I kind of noticed this when I was a junior. I experienced like male seniors, and they are chill. They're okay. They kind of make fun of you or bully you. Not well. At least when I was a junior resident, I had my male seniors were okay. They like to make fun of me, but then it wasn't really that bad. I mean, I would just laugh at them, didn't care. But then when we had when there was a time when our seniors were all female, and that's when shit went down. That's when shit went down. Like each and every one of them was so hormonal. Like one gets angry at you, and then like the next moment the other one's angry at you for some reason that you don't know. You don't know why she's angry. She just snaps at you. And you're like, well, what's going on? Why is this happening? Female senior in surgery are 4 times manlier than you. I think that goes more for like orthopedic surgery. I think female orthopedic surgeons are very manly. They're like macho. I have seen like female orthopedic surgeons, and I think they can lift me with one arm. They look so chunky and like, yeah, they will just lift me with one arm. I think it's like your specialty defines you. If you're like an OB-gynecologist female, you're hormonal. If you're an orthopedic surgeon, a female orthopedic surgeon, you're like one of those women that fights bears in the forest or something like that. If you're like a pediatrician, you're like a mommy. Like you're a mommy if you're a mommy to little babies. Anesthesiologists are special. Oh yeah, they are. If you're a radiologist, you like dark places. I don't know. Radiologists just stay in a dark room. They just stay in one room in the dark and just look at pictures. They're like antisocial, I don't know. They just stay there and then like look at x-rays. And whatever. So yeah, that's all. Meanwhile, neurosurgeons. Oh, you know, neurosurgeons over here in the Philippines, in here, there are few. I mean, as far as I know, to become a neurosurgeon here, you have to have 1 year of general surgery training, and then the rest is neurosurgery. There's only a few, like, there's only a few. I think there's like only a few residents in neurosurgery. And for some reason, they always have their head shaved. I don't know if that's their tradition here. I don't know if that's in, I don't know if it's a tradition here or if it's a tradition in neurosurgery, like, in general. But they always have their head shaved. I don't know why. They're always bald. Don't allow the neurologist and the neurosurgeon to make contact. Oh god. The hospital will implode. Like, I know some neurosurgeons, they are weird, man. They are weird. They're just, oh, brain. Everything is just brain. I think they're nerds, but brain, I don't know. How about medtech docs? Medtech? Medtech doc? Wait, there are medtech? Medical technicians are like a specialty on their own, and they're not doctors. Neurosurgeon and neurologist big. Oh my god, that's true! They would clash so much. And like, about which patient is operable and which is not. Hydrate, doc. Oh no, I don't have water! I got my water's downstairs. I'll hydrate later. There's no hydrate redeem, since I'm on YouTube. Let's see, but anyway, oh, it's already 10:30 though. I think you guys have any questions about residency? Before, I think this is long enough for medical education stream. Surgery and internal med is more of a meme. Oh yeah, you know, yes. Yan nag-redeem na. You guys have any questions about residency? If you guys have any, I don't know if I did the. What's the most memorable experience you had as a resident? Memorable, huh? Most memorable experience as a resident. Let's see. I can't think of like, wait. Most of my most memorable moments in as a resident is when when a patient, usually it concerns a patient, like if I'm able to save a patient by updating the consultant on time. But then wait, let's see. Okay. Usually my most memorable experience as a resident. Okay, as a resident in this culture, it's usually when they bring us out to, like, cause you know, in the hospital where I trained, they're not as brutal as probably as the government hospitals. They would schedule what do you call this? They would schedule outings like at least once a year. So I remember we had one in Batangas, like 3 days. Okay, 3 days outing. Imagine going to the beach as a resident. Going to the beach. Yeah, it's nice. Like, one of the days you can actually, like, take a break. Yeah. I think we had this, like, twice. I think there was 1 year where we had it twice in a year. But then usually it's once a year. We had those, but the first... Oh no, this one was covered by the department. This one is covered by the department, so this is okay. Do you have to get a malpractice insurance during residency, assuming that it's a thing? I don't think that's a thing here. As a resident, not really, because the patients you handle are under the name of the consultant. So it's a consultant that might most probably need a malpractice insurance. But I don't think that's a thing here yet, malpractice insurance. It's not a thing here just yet. If it's about stories, I have a friend who I think is a resident. He mentioned that he has 24-hour days, and yeah, that's normal. Having at least 24 hours. That's a duty status. Outside USA insurance. Yeah, I think malpractice insurance is more of a US thing or a West thing. We don't have that here. We don't have it yet here. I don't know if they're gonna push for that. I don't think we need it yet, or I don't think we need it just yet. What was the meal that carried you as a resident? Oh, meal, let's see. Fried chicken. Bruh. There's like, in the hospital, there's like fast food everywhere. So imagine all the unhealthy. Fried chicken is my favorite food. It's my comfort food. So I'd be like, oh, I got some fried chicken. But if I had to, like, if it's something that I had to, like, walk around with, I would go to the convenience store and then just, like, buy, like, small chips or whatever chips. And also, of course, Monster energy drink. You know, if it's gonna be a long day, or not a long day, if it's gonna be really tiring, I always had Monster. Actually, before I did not drink Monster that much. Before, it would be Bacchus. Bacchus energy drink. And then I tried Monster and I'm like, oh, Monster is the one. Monster is the one. Before it was Bacchus. Skyflakes. Oh yeah, Skyflakes is good. Korean chicken? No, like fried chicken from like KFC or Jollibee, you know, those things. Okay, yeah. Any more questions? Because I think we're good now. I think we're good. Unless I don't know if I missed anything under residency. It's a complex topic. So, if you're a med student or an intern or planning to take residency, it's like this. If you want to specialize, you have to go through residency. So just pick your hospital wisely and know the culture. So you'll know if you're gonna get into a culture where they really brutalize you or if it's not that brutal. It depends on what you want. Also, to be honest, I really think residency is very brutal, but I think some hospitals, based on what I hear, some hospitals can be a little too brutal to their residents. And what happens, it becomes a cycle. So I think, in my opinion, I think if you want less of that, it has to start from the resident themselves. Like, if you want to break that kind of culture of being way too hard or way too brutal to your juniors, it has to start with you. It is a very hard culture to break or change. But I know from a residency training program that they used to be really brutal, but then they're slowly trying to change that and trying to make it a healthier environment, something like that. So it's possible. It'll just take a while. It really takes a while. It has to start with like one person or one senior that wants to change everything. So yeah. What else? Hi Doc. Hello Azimut. Hello. So put it this way, but then you're just expect that when you go into a residency training program, expect brutality. Just expect brutality. And make sure that you're prepared for that kind of brutality. Think of it this way, this is like your sacrifice for greater glory, you know? Greater glory, because you can specialize and you are, you can get, what do you call this? You'll be, a member of whatever society of the whatever society of the specialty you're taking. And of course, since you specialize, you would have more patients that way. Because if you specialize on something and a patient needs treatment for a disease that is related to your specialty, then you would be getting those patients. Bring a bucket to work. Anyway, yeah, I guess that's all. Let me close this. Yeah, I think we're good. I think that's good. If there's any more questions or not, I think we're good for tonight. Because it is 10:40. Otsupon, guys. So, my next stream will be on Twitch. Tomorrow. Tomorrow, I'll be playing Carry on Twitch. So, for those who just got here, or those who just knew me here on YouTube, I stream more regularly on Twitch. I only stream on YouTube like once a month for medical education. My regular streams are on Twitch, so I have one tomorrow, and that's my last stream for the week actually, because on Sunday I am going to fly to Japan. I have a vacation leave. So yeah, if you want more of my streams, go visit me on Twitch. I have a Twitter, so I am active on Twitter. So I usually post my stream schedule there. I do have a Facebook page also, so you can you can check my schedule there as well. I also have a Discord channel. I don't know if I have no bots for this, so I can't type it all down. I'll just like link you guys to my Twitter or my Twitter, so you guys can like. Because that's where basically all my links are. There, that's my Twitter. You just go there for a schedule. And yeah. Oh, I also have a VOD channel, by the way. So if you missed my Twitch streams, you can check out my VOD channel. I have another channel for Twitch VODs. So if you're not able to watch my streams of Twitch, you can just watch the ones on my VOD channel, which is ano ba yung VOD channel ko? My VOD channel is youtube.com / at ShioriPon VODs, I think. Oh. There we go. That would be my VODs channel. So, yeah, I've been uploading recent VODs there already. Okay. ShioriPon, guys, thank you for coming to my stream. I hope you guys learned a lot. Or about Residency, more of how Residency goes. Thank you so much, guys. And I'll see you guys tomorrow on Twitch. Tomorrow night, same time, 9 p.m. Thank you, ShioriPon. Bye-bye.